I saw these pictures over the weekend of HHS Secretary Robert F. Kennedy Jr. on a Mother's Day hike with the family. And he was taking a dip with his grandchildren in Rock Creek Park in Washington, D.C. Now, I used to live right near that park. And when I saw this, my first thought was, oh, that's amazing. They finally cleaned up Rock Creek. Because I remember walking through that area, park on hot days, and wishing I could dip into the water, but it was notoriously polluted and unsafe with high levels of E. coli. In fact, raw sewage spills directly into the creek. Alas, they have not cleaned up the water in Rock Creek Park. It is still so contaminated, the government bans swimming in the creek, as it has since 1971. Combined sewage overflow, never words you want to see. That's what's on the sign. But this country's top health official doesn't appear to really believe that germs make you sick, so he took his grandkids swimming in that stuff. Dr. Peter Hotez is a professor of pediatrics and the dean of the National School of Tropical Medicine at Baylor College of Medicine. He's also co-director of the Center for Vaccine Development at Texas Children's Hospital, author of The Deadly Rise of Anti-Science, A Scientist's Warning, and he joins me now. In the grand scheme of things, this is not the most pernicious or destructive thing that the Secretary of Health and Human Services has done, but it does seem to me to utterly epitomize the approach, which is like if there's some group of public health experts who have taken water samples, gotten together and made some determination, this is not safe, the default is that they're wrong.
Yeah, I mean, I don't understand why he made that decision to go into Rock Creek Park. I also used to live in Washington, D.C., and you knew not to go there. But, you know, the point, Chris, is this is follows a steady stream of public health disinformation that he's been pushing, whether it's about measles vaccines, whether it's about autism, whether it's about safety of our vaccine supply. You know, first it was, comparing that we're in the middle of this terrible measles epidemic here where I am in Texas. And in the middle of it all, he starts saying, well, you can get the MMR vaccine or you can get this useless cocktail of nutritional supplements, vitamin A and budesonide. And then, he says the hospitalizations were due to quarantine. And then, it goes on. Then he says the MMR vaccine is a leaky vaccine. Who knows what that means? And he actually quoted this false number. He says the immunity to the MMR vaccine declines 4% per year. Where does he get that from? It barely declines at all. There's one study that suggests it may decline 0.04% per year, so it's 100-fold less. Or, saying that childhood vaccines are not tested with placebos, or saying the MMR vaccine contains aborted fetal material. It's absolute nonsense. So it's all wrong. It's all wrong, and it's every few days. It's consistent.
And there's two things here. I mean, one is being wrong on the facts and how destructive it is to be wrong on the facts, both when you oversee the nation's health infrastructure, which he is currently dismantling, like in the actual guts of budget cuts and things like that, and scientists and clinical trials, and also the public messaging. But then there's something deeper and more pernicious to me, even below that, which is a worldview that frankly feels unsettlingly eugenicist. And I want to play something he said about measles that I found to be one of the most disturbing things I've heard from a public official. He's talking about measles. Take a listen to what he says.
No kid should die of measles in this country. Even in 1963, before the introduction of the vaccine, there were 400 deaths a year, and there were up to 2 million measles cases. So it's only very, very sick kids should die from measles, and nobody should.
And your big point is a choice for people to make informed choice.
Exactly. Now, whatever your choice is, you're human, you're entitled to compassion, you're entitled to the best quality health care, and nobody should die of measles.
So he says three times nobody should die of measles. He says no kid should die of measles. Nobody should die of measles. But sandwiched in there, there's a sentence he says, and I think he catches himself. He says 400 deaths a year in 1963 from 2 million cases. So it's only very, very sick kids that should die from measles. And then he realizes what he said and said nobody should. But when he cites as positive, hey, only 400 deaths in 1963, I found that an appalling thing to say. What is your reaction?
Well, particularly, Chris, in West Texas, we've had now 2 measles deaths in perfectly well school-age kids whose only problem was their parents made an executive decision not to vaccinate them with the MMR vaccine. So to say that in the middle of 2 measles deaths in this raging epidemic that's been going on since January, to the point where if this continues, we could even lose our measles elimination status in the United States. This is a big epidemic. It's gone from West Texas up into the Panhandle, into Kansas, into Oklahoma, neighboring New Mexico. It's spreading across the Great Plains, and yet he continues to minimize the measles and continues to exaggerate the very, very rare side effects. That's been his modus operandi ever since I've known him.
You've known him for a long time. You've engaged with him for over a year on the question of vaccines and autism. You have a daughter with autism, which you've written very movingly about. One of the things they've been doing is both characterizing autism in a really unnerving way, unsettling way, offensive way to many, also talking about a national autism registry. What do you think about that?
Well, it's the fact that he talks about kids on the autism spectrum in such dark terms. He says, they need assistance forever in using the toilet. They don't work. They don't pay taxes. My daughter Rachel is an adult now. She works at Goodwill Industries. She gets a paycheck. She pays taxes. She's happy. She has friends at work. She goes to the movies. And she does have intellectual disabilities, but a full life. But he always talks about it in such dark terms. Then he tried to walk it back a couple of days later and said, no, I was only talking about
Extreme
the 25%.
cases, right.
And I don't know where he gets the 25% number either. And then to talk about that in the context of a registry, which doesn't even make any sense, because that registry is not going to have the 2 known causes of autism, which we have over 100 autism genes identified, and there are environmental factors that are associated with it. For instance, if you're pregnant and not aware of it, on an anti-seizure medication called Depakote, valproic acid, it interacts with autism genes, and you're far more likelihood to be born with an autism phenotype. And I had those discussions with him back in 2017 when the NIH asked me to speak with him. And he had no interest in it. I said, Bobby, I was calling him Bobby then. I won't tell you what he was calling me. But, I said, Bobby, you should be all over this. You're an environmental attorney. This is your sweet spot. Yeah. This is your moment. And no interest. But then 2 weeks ago, he talks about, he positions himself as someone as the keeper of looking at environmental causes. He says the scientific community is only saying that it's due to changes in autism diagnostic criteria, which I do think is responsible for a lot of it. But there are environmental exposures, and I can never engage him on it. Now, he's completely switching around.